Our presentation today includes hepatitis C among fatal drug overdoses in Tennessee, and that's going to be presented by Jessica Corona with the Office of Information and Analytics with the TDH. We will also have a couple of case presentations, a Q&A session, and then closing remarks. As always, in order to get credit for your attendance, if you are interested in the continuing education credit, please make sure that you register by clicking on the QR code, or you can click on the link to register through the Southeast AIDS and Education Training site, and then your certification will be emailed to you. All right, next slide. So a few introductions and announcements for those who may not have attended in the past. Please make sure to drop your name and title in the chat, and if this is your first echo session. I'll give you just a few minutes to do that. And again, if you've just joined, if you have any technical issues during the session today, please message Kimber Miller. Her information is in the chat. And Anastasia also dropped the link for the continuing education credit. All right, we'll go ahead and move forward. Jessica, I think you are on. Please feel free to start when you're ready.
Okay, great. Thank you. Can you hear me okay?
Yes.
Wonderful. Well, my name is Jessica Corona, and I work in the Office of Informatics and Analytics at the Tennessee Department of Health as an epidemiologist focusing on fatal drug overdose surveillance. So I'll be presenting on a project that was done largely in collaboration with other groups at the Department of Health, so the Division of Communicable and Environmental Disease and Emergency Preparedness and the Office of the State Chief Medical Examiner. And we all came together, all the authors on the screen, and we looked at the prevalence of hepatitis C virus among fatal drug overdoses in Tennessee. And we did this analysis using 2019 through 2020 data from the Tennessee State Unintentional Drug Overdose Reporting System. So next slide, please. I have nothing to disclose. Next slide. So I think you all are the hepatitis C experts, so I don't have to go too much into detail, but it's well documented in the literature that there is a relationship between injection drug use and hepatitis C virus infection. Some facts about what we knew at Tennessee during this time period is that fatal drug overdoses increased 45% between 2019 and 2020. It's really starting to see the first dramatic increase pre-pandemic and during a little bit. But also during this time, stimulant overdoses have been increasing dramatically. Cocaine overdoses more than doubled between 2016 and 2020, and psychostimulant overdoses increased 406% during that same time period, largely attributed to methamphetamine. Also during this time, hepatitis C infections have been increasing as well. And from other analyses that we've done, we knew that over a third of people who were using stimulants favored injection drug use over other means of administration, at least at the time of their death. So next slide, please. So definitely an implication for this endemic to increase and grow in Tennessee. And this is important because there's a potential for combined intervention and prevention strategies to be implemented together to reach all individuals at one time. So before this analysis, an OIA, we had never really collaborated with other surveillance teams to link our data. So this was really the first analysis demonstrating that we could link Suiter's data to other surveillance sources to really enhance that data set more. And I'll talk a little bit about what Suiter's is in the next few slides, but there's also a thought that the fatal drug overdose population could be used as a proxy to study patterns of drug use and medical history among people who are still alive and using substances. So the goal of this analysis was to examine prevalence of infection by types of substances present on toxicology among fatal drug overdoses in Tennessee. And around this time, there was a big push and emphasis on opioid use, but also we were seeing the increases in stimulant use and injection drug use among people who were using stimulants. So we wanted to focus on stimulants and really see what the relationship looked like there. Next slide. So what is SUDERS? Well, SUDERS is the State Unintentional Drug Overdose Reporting System, and this is a surveillance system nested within the National Violent Death Reporting System that collects information on unintentional and undetermined fatal drug overdoses. We collect around 600 variables for each decedent. So we collect demographic information, personal circumstances, medical history, injury and death scene information, first responder responses. We have all substances in someone's system at the time of death, and prescription history as well. We collect all this information from death certificates, autopsy reports, medical examiner reports, toxicology reports, and controlled substance monitoring program data, which is the prescription drug monitoring program. Next slide, please. For the hepatitis C data for this analysis, we used laboratory surveillance data from the National Electronic Disease Surveillance System-based system. And we were able to identify 3 main types of hepatitis C virus cases: positive cases, potential cases, and cleared or cured cases. And I'll let you read the definitions here, but for this analysis, we collapsed all these categories and created one indicator called history of hepatitis C virus. Next slide, please. For our study data set, we used the 2019 through 2020 data from SUDERS. This includes the whole year, so January to December. And then for history of hepatitis C virus, which was our main variable of interest, we used the laboratory surveillance data, narratives from autopsy reports, and then also hospital discharge data to identify our final sample. I'll go into detail in a few slides of exactly how we came to our final sample of decedents with a history. Next slide. And then before I get into how we identified hepatitis C, this is the breakdown of how we identified substance classes on toxicology. So especially since we have toxicology, it's very difficult to tease out one specific class being involved in a drug overdose, since most of the overdoses are polydrugs. So people will have opioids and stimulants, combinations of benzodiazepines, antidepressants. We just had a case where a decedent had over 30 substances in their toxicology. So a lot of co-use of different substances together, whether people know they're using them or not. So we usually identify classes like this for our analyses, especially when using SUDERS toxicology. So a stimulant positive death would be any stimulant present on toxicology, regardless of what other classes are present. And we usually include drug metabolites as well. Opioid positive, kind of the same idea. We include both prescription and illicit. We look at opioid and stimulant positive deaths, methamphetamine positive deaths, cocaine positive, opioid positive to stimulant, methamphetamine and opioid positive, and methamphetamine positive with no opioid. For this analysis, we did not focus on amphetamine positive death just because it's a metabolite of methamphetamine. And when we look at decedents with amphetamine present but no methamphetamine, the sample is very small and it's hard to know for certain whether they were using the prescription substance or methamphetamine had metabolized. So we try to break it down like this. And we were really trying to focus on methamphetamine for this analysis and look at different patterns of use or different classes, I guess, between opioid and stimulant use while focusing on methamphetamine. So next slide, please. For our analysis, we used demographic characteristics, including age, race, sex, marital status, and education. That information is obtained from death certificates. We also looked at circumstantial information, which is a huge strength of SUDERS data. So we looked at history of hepatitis C virus from the laboratory data. And then on SUDERS, there's a narrative text on the autopsy reports that looks at their medical history. So sometimes there'll be like one line of text that says decedent had history of hepatitis C virus. We also looked at some evidence of injection drug use. This is again obtained from autopsy narrative text. So if there were needles or syringes on scenes, cookers, filters, or tourniquets, things like that. We also looked at history of substance use disorder, history of mental health condition, and history of treatment for substance use disorder. And these were abstracted from autopsy narrative text and then also prescription information text as well. For this analysis, we did simple descriptive statistics to look or to compare between type of overdose death and history of hepatitis C virus. Now, we limited our analysis to cases with an autopsy report to ensure that we had the most comprehensive data. Next slide, please. Okay, so this is a flow chart showing how we identify hepatitis C virus final case sample. So between 2019 and 2020, we identified 4,976 accidental or undetermined fatal drug overdoses in Tennessee. When we limit to cases with an autopsy, we found 3,570 cases to have an autopsy report. We sent those cases to the hepatitis C surveillance team in CETA, who linked the suitors data with the laboratory data, and they found that 804 decedents had a history of hepatitis C virus. And we also have that variable in suitors from the autopsy narrative where we collect history of hepatitis C. And when we compared between the surveillance data from the lab and the suitors data, we saw that there were 109 cases from suitors that said a decedent had a history of hepatitis C, but were not confirmed by lab. So we wanted to look into those data and see if we could confirm that anyway. So we linked those 109 cases to hospital discharge data system data and looked for any ICD-9 or 10 codes dating back to 2012, just because that was our earliest the data set went. We found 25 cases that way, and then we sent the remaining cases to Dr. Amy Haas, the medical examiner in Knox County, and she manually reviewed medical records and any histology reports for those decedents and found an additional 47 cases. So our final example of hepatitis C virus cases was 876 decedents. And then when we compare that to what we would have found just using suitors data, the hepatitis C virus cases doubled. So a large improvement in identifying hepatitis C virus among suitors decedents by linking to the laboratory data. Next slide, please. This slide shows the breakdown of drug type by suitors deaths. So again, the final sample, 3,570. The main takeaways here are that 90% of deaths had an opioid on toxicology. So opioids are predominantly involved in most deaths, but stimulants were present in 50% of deaths, methamphetamine in 36%, cocaine in 16%. So methamphetamine are the predominant stimulants being present on toxicology. And then the last column is looking at methamphetamine and opioid use together. So a relatively high proportion of that as well. Next slide. This slide shows the prevalence of hepatitis C virus among suitors decedents. So 3,570 again, final sample size. But the first column is showing the prevalence among all deaths. So among all suitors decedents, the prevalence of hepatitis C was around 25%. Which is consistent when looking just at opioid positive, and because most deaths had an opioid on toxicology. When we look at stimulant positive, the prevalence increases to 29%, then to methamphetamine positive, 34%, and methamphetamine and opioid positive on the last column, 35.4%. So definitely something going on between methamphetamine and opioids, or just methamphetamine based on toxicology. Next slide, please. This slide is showing the prevalence of hepatitis virus as columns, and then the orange line is showing the evidence of injection drug use. So the patterns here align fairly well. So people who...
Hey, Jessica.
Yeah.
I'm so sorry to interrupt you, but for some reason the audio is going in and out. Is your speaker? Try now.
Can you hear me? Yeah.
I can hear you now. Can everyone else hear her okay?
It still sounds like she's far away.
Okay.
Maybe I'll turn
I've
off
got some people that can hear and some people that can't, evidently.
Okay.
So I'm not sure.
Let me turn off my video maybe, and it will work.
Okay.
Okay. Is this any better?
Slightly. It kind of sounds like you're a little distant.
Okay.
I'm sorry.
That's okay. Okay. Let me see. Okay. Is this any better?
Can anyone let me know?
No, Jessica, you are breaking, first of all, and secondly, it seems like everyone is saying that you are far, so,
Okay.
and also breaking a lot, so.
I apologize. I am right next to my laptop. It might be my internet. Let me see if I can hop onto my phone Wi-Fi.
You sounded really good right there.
Okay, it was good now.
That's better on my end. What about, can I get feedback from anyone else?
It's better on my end as well.
Okay, let's try that if you don't mind.
Yeah, no, maybe it's working now. Okay, great. Okay, so this slide is showing prevalence of hepatitis C virus. So the blue lines or the blue columns are showing prevalence. And then the orange line is showing seen evidence of injection drug use. And the pattern was very similar between the two, which is what we would expect, but it was great to see that data. So the people who had stimulants on toxicology and prevalence of hepatitis C also had high percentages of seen evidence of injection drug use. Next slide, please. This slide is showing characteristics of suitors' decedents with a history of hepatitis C virus comparing to those without a history of hepatitis C virus for some select circumstantial indicators. So the takeaway here is that suitors' decedents with a history of hepatitis C had higher proportions of methamphetamine involvement, history of substance use disorder, history of mental health condition, ever being treated for substance use disorder, and seen evidence of injection drug use. So not all of these are bad, though. In suitors, we typically see low levels of people being treated for substance use disorder. So the fact that a higher proportion of decedents with hepatitis C virus were treated for substance use disorder could indicate that there was some linkage to care going on when people were receiving treatment for hepatitis C virus or being tested for it. So not anything that this analysis could substantiate, but what future analyses could perhaps look at. Next slide, please. Okay, so main findings, really the partnership between OIA, CDEP, and OSCME allowed for better capture of hepatitis C virus. So enhancing the data linkage that we're doing is really important to improving our surveillance system and improving harm reduction. We found that a quarter of suitors' decedents had a history of hepatitis C virus, and that the hepatitis C could be driven by a combination of opioid and stimulant use, but particularly methamphetamine and behaviors of injection drug use. And this could matter for prevention. Next slide, please. So studies have shown effectiveness in combining opioid use disorder treatment with hepatitis C virus treatment. And while there's no established pharmacological treatment available for stimulant use disorder, hepatitis C treatment could be provided alongside contingency managed programs, at-syringe service programs, supervised consumption sites, or along HIV counseling. So a lot of different opportunities where hepatitis C and injection drug use people could be reached at the same point in time. And then most overdoses in Tennessee are polydrugged. So even when we're focusing just on stimulants, we always promote the continuation of naloxone training and use just because of the high proportion of opioids. Next slide, please. And the main takeaway here is that there's a relationship between methamphetamine-involved fatal overdoses and hepatitis C virus. And this could allow for combined treatment strategies to help to curtail this pandemic in Tennessee. And their partnership between communicable disease and drug overdose surveillance teams should continue to allow for improved surveillance and collaborative treatment modalities. So next slide. That's really it. Thank you. I can answer any questions anyone has at this time.
Please feel free to come off mute or put your question in the chat. Dr. Chastain, I see you have your hand raised.
Yeah, Jessica, thank you so much for a great summary of some really important work. I was wondering if, while this is a focus predominantly on overdose within Tennessee and Hep C rates in that context, if there are comparative public health studies or data that's been done in other areas of the South, including Kentucky and or other surrounding states, or in other geographic locations, or if there's not really similar data available.
So that's a great question. At the time of this analysis, we did not find any exact study to compare to, but the VA has done a lot of analyses looking at hepatitis C virus and substance use disorders. So they're probably the closest group studying this, at least when we did this, probably in 2021.
Jessica, I actually have a question. Is there any preliminary data for like the most recent, this like last year? And also, has the fentanyl situation, have we seen a change or increase in any reported deaths?
So since 2020, deaths increased dramatically up until 2022, and we're seeing a slight decline, but similar patterns of mostly opioid use and a lot of stimulant use as well. We have not updated this analysis, but we are doing an optional strategy for our new overdose stated action grant from the Centers for Disease Control and Prevention. And part of that is a data linkage strategy where we're linking fatal drug overdose surveillance to really any other data source that we can get our hands on that would help inform any harm reduction. So if we could definitely redo this analysis or add indicators for HIV infection or really any other disease where we could potentially treat or provide education for substance use disorder.
Thank you for that. Is there any other questions or comments?